This conference will now be recorded.
Welcome in, everybody. We're going to be discussing chapter 22, which is toxological emergencies. You notice that this chapter is quite long, so chances are I'm probably going to break it up into two different sections as far as lecture. So let's dive in. These are readiness as far as reading lessons. These are all of our topics and our objectives. So our case study, we have EMT Tricia and Brian just obtained the chief complaint and some preliminary information from the mother of a 2-year-old boy named John. John was 4 with an open container of lamp oil, and because he had the substance around his mouth, his mother believes he may have drunk some of it. John is awake, alert, seems a little scared at the commotion now going on in his home. So additional questions. What additional questions should John ask the mother? So dive into that sample history as far as, does he have any allergies? When was the last time that you saw him? Because then that way we can actually go ahead and pinpoint as far as when the ingestion occurred. So if you ask mom, all right, how long did you leave him alone for? And she says, I left like 6 minutes ago to check on dinner on the stove, and I came back, and that's where I found the child with the lamp oil around his mouth. Okay, now we're looking at that window as far as when that point of ingestion occurred. If we ask mom, oh, I fell asleep on the couch and it was probably like an hour, and so he was unattended for an hour. All right, that's a huge different spectrum as far as when the ingestion actually occurred. Product information, what information do they need as far as the product? The lamp oil, if it's in a container, if it's in a box, go ahead and take it with. If you don't have anything like that and you just have a open bowl of liquid, go ahead and take some, put it in a container from mom's kitchen and take it with, because they should be able to do some studies at the hospital as well as far as what exactly is in that content. And then what resource will be helping and assisting the EMTs with treatment and transport decisions? Poison control. That is such a great tool for all of us on both ends of the spectrum as EMS providers, and then also for those of us who are parents or babysit or have nephews or nieces. I've used them quite a few different times throughout my current career, and they're fantastic. And or we could also utilize the ER in our medical directors as well. So introduction. Poisoning can be accidental or intentional. Poisoning, as far as intentional suicides, this is the most common type of attempt for suicide for females, is ingestion poisons. Males tend to be a little bit more violent as far as suicide attempts and successful suicides. We'll talk a little bit more once we get to behavioral health emergencies. Most calls or many calls to poison control centers involve children. If you don't have kids yet, and if you anticipate of having kids sometime in the future, or just with your progression within your EMS career, you will know that kids put absolutely anything and everything into their mouth and then they swallow it. They're like dogs with 2 legs instead of 4. And then there are special problems associated with drug and alcohol emergencies. So our routes of exposure, this could be very similar to our anaphylactic reactions, which we went over last chapter. They could be from injection, ingestion, inhalation, or from skin contact as well. Most of the time, it's either going to be from injection and or ingestion or inhalation. Those are going to be the 3 common routes. Toxicology, this is going to be the study of toxins and antidotes, one of our key terms, and oftentimes it shows up on your tests in your national registry. Overdose of drugs or medications is a type of poisoning. Whether they are intentional or unintentional, it's still going to be classified as a type of poisoning. So those are our 4 routes. We got ingestion, inhalation, injection, and absorption. So there is our 4-year-old with the lamp oil, ingestion that. So with ingestion, oftentimes the signs and symptoms that this is an overdose of that poison is going to take a little bit longer. Usually the signs and symptoms from that with ingestion is about 30 to 60 minutes, depending on our patient and depending on what they took. Inhalation, quite a bit faster. This is a route that a lot of individuals actually choose to get high with. Not super common now because the street drugs, as far as heroin and opioids and everything else, are relatively inexpensive. This was really common in the early 2000s and the late 90s where drugs were actually quite a bit more expensive. But inhalation, for this specific instance, they're actually spraying some type of cleaning solvent within a bag and then they're huffing it. So it's another, when you hear the term huffing, this is what they're actually referring to as spraying chemicals into a brown paper bag. In inhalation, other inhalation could be unintentional. So carbon monoxide poisoning is a type of inhalation poisoning. Injection, so most common is going to be heroin abuse, opioid abuse, but we could also see ingestion poisonings come from prescribed medications. So one of the leading causes of suicide for elderly patients within the nursing home setting is actually taking too much insulin through injection in order to drop their blood sugar and then go suicide by that route. And then absorption. So we can see this individual got exposed to lime, which is a common organophosphate poisoning that we could see a lot of different chemicals that individuals work with, especially in construction sites and then in the garage. I mean, we see a lot of different types of accidents, especially, I mean, this is our typical patient that we're going to see that is involved in this type of poisoning. Tends to be a 20 to 50-year-old male patient working out in the garage, working out in the yard, or working within the construction site. Please do not take that as sexist. Females do these things as well. But when we're looking at our specific population, when we're looking at EMS response, this is the higher rate as far as organophosphate poisonings. As mentioned, for females, ingestion poisonings is quite a bit higher. Our signs and symptoms, they are going to vary drastically. And it depends on the type of poison, and it depends on the type of route, and it depends on the type of patient. So I wish there could be a giant chalkboard for every type of sign and symptom that you're going to see, the best depending on that specific poison. You're not going to have that. I mean, you're going to have Google and you're going to have the Poison Control Center and utilize that Poison Control Center because they're going to be your best bet for something like this. What we're going to be doing as EMS providers is trying to remove that poison either with decontamination. So we're actually removing that poison in the event of our male patient who was introduced to Lyme, and we're providing an antidote. So for a patient who injected heroin, we're going to be providing airway therapy as far as airway breathing, and then also Narcan, which is going to be our antidote. When we are managing that patient, try and gather up as much history as you can. So what they take, how much they took, how long it's been, have they done this before, was this intentional or unintentional, and be aggressive as far as your airway and your breathing treatments and making sure that we're protecting ourselves from contamination from that poison. Antidotes, as far as antidotes for our patients, being EMT providers, very few. Basically, what we have is Narcan, and then some EMS providers are actually going to be carrying around activated charcoal, which is going to be used for ingestion poisonings. Again, the activated charcoal, as we discussed with pharmacology, is not commonly used anymore. So our ingestion of our poisons. So this is going to enter the stomach and then absorb through the small intestine. So always try and determine what and when that substance was given. So the most common ones that we're going to see: over-the-counter medications, illegal drugs, and then household products and cleaning agents. So over-the-counter medications, where we see this the most, is elderly patients or maybe vulnerable adults where they don't know or can't remember when they took their medications and they double or triple up their dose. Illegal drugs, the highest incident rate with illegal drugs tends to be males in their adolescence and early adulthood phase. And then household products oftentimes is going to be our preschool children or our pediatric patients when they got underneath the sink. Other common ingested substances, so our foods, petroleum products, plants, foods is going to be considered a poison when they're spoiled or underprepared. So underprepared chicken or meat, if they're not cooked to a certain temperature, then all of that bacteria is still within that food substance. And a lot of times patients will display relatively mild signs and symptoms. Oftentimes they're not going to be called for food poisoning. They're going to be able to take care of that themselves. As discussed, medication misuse and or medications taken with alcohol. Every medication that you're going to get from a pharmacist or over the counter is going to have a specific labeling instructions as far as what you can take with what or what you're not supposed to take with what. And a lot of medications, they advise you not to take alcohol in that medication because they have what's called a synergistic effect. So synergistic means that the medication acts compoundly within another medication. So for example, our nitrites, so our nitroglycerin for cardiovascular patients, they work synergistically with erectile dysfunction medications, which means that they significantly drop the blood pressure. Poisonings, number one cause of accidental death among children. The second leading cause of death is going to be drowning. And then the third leading cause of death oftentimes is falls or motor vehicle accidents. So if you do have children, make sure that you are locking underneath your kitchen sink. They're like little Inspector Gadgets. They seem to get themselves into everything. So our assessment-based approach, conduct our size up, our primary assessment, conduct our secondary assessment, making sure that you're protecting yourself and going through your airway, breathing, circulation with your patient, diving into that history exam, and then reassessing. Most of the time for poison patients, this is going to be relatively non-emergent. A lot of times with ingested poisons, you're going to get calls that baby got into the ashtray and ate a bunch of cigarettes, and you're going to arrive on scene and you're going to provide very subtle care and then go ahead and provide that transport. Look for major signs and symptoms as far as anything that's going to compromise the airway, the breathing, the circulation. The common signs and symptoms are going to see this: swelling of the mouth, nausea, vomiting, could be diarrhea, and then altered mental status. So significant findings. So this is a burn around that patient's mouth. So with this, we're concerned of a couple of different things. All right. If we're seeing that redness and that swelling and that edema around the cheek, if they ingested that, what is that doing to the inside of the esophagus and the trachea? And then also with that, I mean, that is a very goofy looking injury as far as burns go. Could this be a sign of child abuse as well? Did mom boil up milk and then hand it to their individual as far as causing harm to that child? Other signs and symptoms based on our ingested poisoning, we could see abdominal pain and tenderness. So this is make sure that we get our hands on our patients and check those different quadrants. Could see burns or stains, unusual breath or body odors, respiratory distress, and then also altered heart rate. A lot of poisonings will actually drop the heart rate. So we're going to see bradycardia instead of tachycardia with a lot of our emergencies that we're going to respond to. Other things, pupils are big ones when we're looking at poisons because oftentimes they compromise the central nervous system, which again is going to affect the pupil dilation and or constriction. So downers, most of the time we're going to see smaller pupils. Uppers, we're going to see dilated pupils. And when I say downers, I'm going to say drugs that decrease the central nervous system. So our opioids, they're pinpoint pupils. They're actually considered a narcotic, but they decrease the central nervous system. Our ecstasy, our cocaine, they jack up the central nervous system, and we actually see blown or dilated pupils with that. Could also see coma, and we can also see seizures. Very common type of poisoning can cause seizures, or our bath salts and our synthetic marijuana. When that was a high drug craze, that caused a lot of individuals to actually go into a seizure. As far as administration of activated charcoal, in the event that your EMS agency carries activated charcoal, if an individual ingested that substance and it was within 1 hour, then you can go ahead and provide activated charcoal as long as you're not meeting any of the criteria as far as contraindications. What activated charcoal is going to do is it's going to bind around the substance while it's still in the stomach before it gets to the small intestine, and then it's going to create a compound around that substance so that I can go ahead and pass that substance without the small intestine or the large intestine actually absorbing that into the bloodstream and into the system. So our emergency medical care, biggest thing, scene safety for ourselves, scene safety for our patient. Go ahead, attack the airway, breathing, circulation, provide airway and breathing therapy as needed, and then identify any immediate life threats. If we have significant signs and symptoms, this is going to be a high priority patient and transport immediately. Emergency medical care, activated charcoal, and then also bringing that substance with to the hospital and reassess every 5 minutes. Inhalation poisons. So thousands of people die every year from inhaling a poisonous vapor or fume. The most common one is going to be carbon monoxide poisoning, which is right around this time of year. So carbon monoxide is the incomplete combustion of carbon, creating carbon monoxide, which means one oxygen molecule, and that creates that compound. So inhalation poisonings, the signs and symptoms occur much more rapidly than are in ingestion poisons because they immediately enter the system into the blood and then also affect the central nervous system. So common inhaled poisons, we could see ammonia and chlorine gas. So those are very hazardous materials. Not super, I wouldn't say that this is common, but this is a common emergency that we might respond to because of the significance of those. Could also see industrial gases, sulfur dioxide, carbon monoxide is going to be one of the key elements. And then we could also see solvents from dry cleaning, fire extinguishers, degreasing agents, a variety of different poisons that we can come across because there are so many different hazardous materials that are out there. And then be cognizant of what area that you're responding to. So if you're working in Duluth, let's say for Mayo Clinic medical transport, you're responding to calls within St. Louis County and Douglas County, and both of those counties have a heavy amount of industrial plants, and then also railroads and major highways that circulate throughout that system. So your chances of actually running into those different types of hazardous materials are quite a bit more substantial than if you're working in Cook County or Lake County, which they're quite a bit more rural. They're not heavily industrial. They do have major highways and railways going through their system, but they're not quite as prevalent as, let's say, Duluth and Superior. Huffing, as mentioned earlier, this is going to be intentional poisoning from some type of synthetic compound, specifically cleaning agents that they're going to put into a brown paper bag, and then they're going to go ahead and huff that. So our assessment-based approach, conduct our scene size up, provide our primary assessment, airway, breathing, circulation, fix those as needed, and then dive into our OPQRST and our sample history, and then getting our baseline set of vitals. So make sure that we're protecting ourselves and only do as much as what you're trained to do. So if you individuals in this class are strictly going for medicine, as EMS providers, you're not going for fire or hazmat or special rescue, know your limitations. You arrive on scene for a possible poisoning, and as we can see before we even go into the structure, that there's a heavy amount of smoke and or chemical compound. I am not going to enter that scene because I don't have the training, I don't have the PPE. If I'm responding as an EMS provider on a fire department and I am trained with hazardous materials to go in, I'm going to don my appropriate PPE, I'm going to enter that scene, and then I'm going to extricate that patient to a safe area so that we can provide care for that individual. Administer oxygen to the inhaled poisoning patient. So this kind of contradicts our 94% O2 saturation levels. Generally, any patient who has inhaled a poison is going to need oxygen therapy. Remember, carbon monoxide will give us a false reading as far as our O2 sensors. Diving into signs and symptoms, we could see difficulty breathing, chest tightness, cough, stridor, wheezing, crackles. So those are a variety of different abnormal lung sounds that we could hear depending on the poison and then also depending on how the patient actually reacted to that specific poison. And then very similar to our ingestion signs and symptoms, you can see headache, dizziness, heavy amount of secretions, and that actually relates back to our organophosphate poisonings. Oral, pharyngeal burns, seizures. Again, there is a laundry list of signs and symptoms that we could see depending on what the poison was actually introduced into the system. Our emergency medical care, first and foremost, protect yourself, protect your patient, get them out of that environment so that you can actually start providing the immediate treatments that this patient needs. Administer oxygen, high flow. Again, regardless of that SpO2, provide positive pressure ventilation as needed if that respiratory system is compromised so that they're breathing too slow and or too fast. Bring the chemical information with you to the hospital and then make sure that you transport rapidly. All right, you've arrived at a greenhouse where there is a report of a worker inhaling a sprayed pesticide. The person who meets the ambulance urges you to hurry, staffing that the patient is not responsive and seems to be having difficulty breathing. Click on the first action that you should take. So the first action is always going to be scene safety, but let's dive into. Open the airway. Again, that is diving into our ABCs, obtaining information about the nature of the exposure, begin positive pressure ventilation, or remove the patient's clothing and decontaminate him. So diving into our scene safety and our ABCs, the first thing is either going to be A or B. And before I actually put myself into that scene, I want to try and obtain some more information. So this goes back to our scene safety. Once I determine that I can actually enter that scene, I would probably either choose A or D, opening up that patient's airway and decontaminating them. And it did it to us again. I don't know why it's doing that. Anyways, we're going to break here. And then I am going to finish up the lecture with another lecture, and that's going to be labeled as far as chapter 22, second session. Thanks.